joining me today is Dr. Valerie Mukanga. She is a dentist practicing in the Dallas, Texas area, and I'm so happy she's here with me. I'll have her introduce herself and then we'll get started with an exciting topic for today.
Hi, Dr. Loom. Thank you so much for having me today. Such a pleasure. So anyway, I'm Dr. Valerie Mukanga. I'm a general dentist, and I have my own practice here in Dallas-Fort Worth area, precisely in Arlington, Texas. And the name of the practice is Healing Wings Dental, and really we provide all sorts of oral treatment, dental care, from preventative to treatment, and that's pretty much what we do.
Awesome. Thank you. Thank you for joining me today. So, today I'll lead with a patient encounter I had recently. I had a mom who came in, and her main concern was like, my child only wants to eat candy. He will not eat anything else, only candy. And I know we, as pediatricians, we talk about oral health, dental hygiene, we refer all our kids to you. When you have a child or anybody who eats a lot of candy, how do you approach those patients?
It's very unfortunate because a lot of parents, out of not being aware or maybe for lack of knowledge, they don't really realize the problem that can be raised whenever their children feast on candy and such things. And it's very, very destructive for their teeth. We highly recommend that they would reconsider and change the children diet because cavities sugar rather is terrible for the teeth. In fact, it leads to cavities, which is the reason why I mentioned cavities. What happened is that bacteria, they would actually feast on all this sugar that stay in the mouth, and it could be candies, yes, but it's more than candy. It's any sorts of sugar that actually they found in the mouth, and then they're going to eat it up and produce acid. So the byproduct is acid, and that's what is going to now start to deteriorate the tooth surface, causing cavities. So if you know any sorts of sugar or any food that can be decomposed into sugar can lead to bacteria creating cavities because of the breaking down of what they do eat, producing acid. You can only imagine if you're just bathing your teeth with all these sweets, candies, even soft drinks, even juices, and sometimes even milk. So yes, we definitely discourage them from doing that. And sometimes it's not the parent. In your case, it was the parent herself that talked about her child, but sometimes it's the grandparents. They would go to the grandparents' home, and the parents are doing a great job at monitoring what they eat, but they go to grandma, grandpa, and the babies get whatever they want, candies, cookies, all of that. It's very dangerous for the kids.
Yeah, and absolutely, I like that you brought up that it's not just the candies, right? There are other things that have hidden sugars in it, and it's about that process where if it ferments down to the sugars and then the acids and stuff, and then you lead to cavities and stuff. So sometimes you could be like, oh, I'm brushing my child's teeth twice a day, but they still have cavities and stuff. And I've seen parents who would give their kids gum at such an early age where they're constantly just chewing that gum, like you said, bathing their teeth with all of this. So it's like there's no given time where there's a break between meals where it's just constant bathing and stuff. So when you get to that too, as far as cavities, what are the pain points as far as cavities with kids? What do you see as the main problem with cavities?
The main problem is that it starts small, but then it grows. So at that point, when it starts growing, that's when you see little kids with like dark spots on their teeth, in their mouths. But the thing is, sometimes cavities does not necessarily present as those dark spots. Sometimes, it would be some white lesions, and that's how cavities would start. But like as far as causing pain, it would be painful. In fact, cavities is one of the major reasons why kids miss school because of pain. And it's not just pain because the structure of the teeth under the enamel, which is the outside white surface of the teeth, The part that's underneath is very sensitive. So when that has been exposed, it's going to cause a lot of pain. But beyond that, as cavity progresses, it can start now affecting the nerve because we have nerves inside the teeth, and now you're looking into the process of having infections. There's some kids that you would want to treat them, and you see some little pockets of pimples type of things called fistula, and they are full of pus. And so that's really painful because then either we can treat the child with having baby root canals, or sometimes it's so far gone that children are now losing, teeth. There's this little girl that I will never forget. I think she was about 4 years old, and by the time her parent brought her to the office, it was so bad, because she was just about losing all of her teeth. So at that point, we really just sent her to a specialist, because she would have a specialist for children, and a pedodontist is what they call them, and they had to treat them under sedation. And when she came back, my little friend, she had maybe 4 teeth left, so all her molars are gone. And it's rare, but it can happen. So those are kind of like pain points, just pain, missing school or infection, having to take off, having to be in so much pain. That's what we want to prevent that.
Talking about your patient and even going back to the cavities, where yeah, when you have pain, then you have kids who, if your child is already picky to begin with, that they want to eat only candy, now you have those kids who are associating pain with eating, and then they don't want to eat even more. So you have not only the pain is affecting their nutrition, because they don't want to eat because of the pain, they're losing time at school, and your poor patient who comes back now, this is a 4-year old with all her teeth pulled out and only having four. That means she's going right back to maybe infancy, where she, you start out with only four teeth, and you're just doing all purees and stuff. So that goes a long way, not only like immediate, there's so many long-term effects that will come because of a cavity that most people would take it for granted. Oh, it's just a cavity, can you just pull the tooth out, right?
Right. That the parents just ill informed about oral, health. And so now when they came, I remember seeing them the other day, and they were asking me, how long will it be before she gets her new teeth? Some of these, at least you start having molars, the first permanent molar around 6 years old. But like a lot of these teeth, they don't come until the child is maybe like 10. It can be a problem.
One other question I have is I see a lot of kids with cavities. Cavities, as we know, is one of the most common chronic disease conditions. I think we mentioned it the last time we came in. And I see a lot of kids either with tooth that have been pulled, or feelings or sealants, which are, good to either arrest the progression of the cavity. So if it's gotten to a certain point, we've pulled it out because we have to. Are there any complications to pulling those out before it's time for the permanent teeth to actually come through?
Yes, there are definitely complications, especially when the children don't see a doctor on a regular basis. So when a tooth is removed, and especially posterior teeth, like those little molars, when you pull them before time, it can cause other teeth to kind of push into those spaces. And the reason why I said if they don't come to a dentist is because when they do come, if a tooth has to be pulled, we create something called a space maintainer that would actually keep hold of that space, so that whenever the permanent tooth erupts, it can actually assume the right position. When you don't, you can end having teeth that collapse into those spaces, and then the teeth, when they want to actually erupt, they're going to erupt in the space that they found. So then later on, you find kids having to have maybe braces, or sometimes when the tooth wants to erupt, it can create other problem. If it's not in the right position, it can cause cavities on the teeth that actually, because of the pressure, cause erosion on the teeth that assume those positions. It can become a problem, and a costly problem whenever a tooth is taken out before its time.
Awesome, thank you. So we've heard about cavities. most chronic diseases. And one thing that most people don't take it for granted, mainly because we think it's just something simple. But as we've heard from Dr. Valerie today, it could cause severe complications, both short term and long term. Now, we did mention nutrition too. What are there specific nutrition guidelines you would recommend for a family who's dealing with cavities? Like, okay, well, this is where it is. Like, what kind of foods are good for my oral health?
Yeah, so the good thing is it kind of like coincides with the type of food that are good for your overall health because as we say, oral health is part of your overall health as well. So you definitely want to eat a lot of fruits and vegetables. Vegetables go a long way, especially fibrous ones, because they will also help us in keeping your teeth clean, all that fibrous tissue. Fruits are good as well, though some fruits can sort of like cause some type of problem. Say for example a lot of citric food, like your oranges, your lemon. A lot of people, especially from what I've seen in the area where I am, you have a lot of Latinos that actually suck on lemon, and that can end up causing erosion because it has a lot of acid, right? When we talked about the process of cavities, we said that the bacteria are actually eating sugar, producing acid that are going to cause cavities. So now when you're eating the acidic food straight, it can also lead to that sensitivity, erosion of teeth. So when you do eat those kind of fruits, which are rich in vitamin C, so they're still good, you want to make sure that you drink a lot of water. Okay, because that's going to dilute the acid content. And also, even talking about water itself, water is really good. It's going to hydrate your mouth, it's going to keep your mouth fresh, it's going to hydrate your body, hydrate the teeth themselves, and so it's also going to wash out some of the sugar so that's in the mouth. So very, very good to drink lots of water, lots of water, especially whenever you eat your fruits. Make sure that you drink a lot of water. You're drinking coffee, whatever you're drinking, drink a lot of water after that. So lots of fruits, lots of vegetables. Those are really highly recommended for your oral health.
Awesome. Thank you. Thank you. And just to reinforce on that hydration, because we know sometimes dry mouth too can
Hmm.
be another risk factor for cavities, right? Because we need
Absolutely.
our mouths washed up. So really making sure that yes, we're washing off the acid because we're trying to prevent cavities, but we need to really have hydration with water, because if you're hydrating with juice only, then you're really going back to where we started, right?
Right, right. And so, yes,
Yeah.
definitely dry mouth, the way that works is that you have less saliva in your mouth, and saliva actually protects, it actually causes, it make it difficult for bacteria to actually adhere to your teeth. So once you have less salivary content, it's going to lead you to be more prone to having cavities. And another thing that I wanted to say is that you mentioned gum when you were describing children, chewing gum and having no rest. So what if you have to give your child chewing gum, make sure that you give them, and even candy, there are candy that are sugar free. That means that they have some sort of sugar that are non-carcinogenic, meaning that they do not lead to the production of the creation of cavities. So try to veer towards that, because sometimes it's hard to just cut it cold turkey. Try to go towards those and see how those help. It would be better than just, eating regular candies or chewing on regular gum.